So people often ask, how do I know if I have an eating disorder? And it's kind of tricky to know, honestly. Eating is something we all do every day in our lives, and thinking about food or thinking about dieting or losing weight is kind of a normal part of life in our culture. When it crosses over to being a serious problem, it's often when you notice that you're thinking about it all the time, you're getting anxious about what you're going to eat or not eat, you're thinking a lot about your body, how you look, wanting to look different. It becomes an obsession almost, something you can't get out of your head, something you organize your day around. When it crosses over into being really an eating disorder, is when those thoughts and behaviors are really starting to impact your life, how you do things socially. Maybe you're avoiding eating with other people, and it can absolutely get to the point where your health is very seriously impacted. Eating disorders take a lot of different forms, but basically, when you find yourself thinking a lot about food and your body and changing the way you eat, you're probably on the road to developing an eating disorder. There are different ways that people find themselves inching towards having an eating disorder. The most common path that I hear is someone who starts to be dissatisfied with how they look, starts to think about changing their appearance, might start to change their eating behavior, maybe by cutting out desserts or what they consider to be junk food, fast food, maybe starting to exercise just a little bit more. But then it's never enough. The individual starts cutting out more and more things from their diet, starts eating in a much more restrictive way. Some people will cut out gluten, things with wheat in it, might cut out lactose, might cut out red meat. Basically, the diet becomes more and more limited in variety. Along the way, they oftentimes will start to exercise more and more and more, and the thoughts, the obsessional thoughts, start to become more intense. Behavior and getting together with people starts to be organized around the dieting and exercise patterns. And usually about 3 or 4 months into that, it's as if a switch flips, and suddenly it's really all you can think about. It's most of what you're doing. Your health and your relationships start to be impacted. Oftentimes that leads to a picture that is defined by being called anorexia nervosa. Another situation might be where your parent or a roommate or a friend catches you doing something, maybe vomiting in the bathroom or skipping meals or hiding food, or becomes worried about you and reaches out to you and says, hey, I'm noticing these changes. I'm worried that you might have an eating disorder. Oftentimes, the person who's hearing that for the first time might say, no, there's nothing wrong with me, I'm fine. And the friend or parent might just kind of walk away and say, okay. But that's your opportunity also to come back a day or two later that night, and say, you're right, I've been kind of worried about myself too.